Okay, get ready for the review for customer service. This is more patient care and customer service, okay? A lot of these questions are practical, so I expect you to answer the questions, plus you had skills in the campus, so you should be more versed with it. Okay, you ready? Open your chat boxes. We'll do it this way. Chat box. Ready? All chat boxes open? Okay, let's do it. A well-groomed employee conveys A, punctuality, B, selfishness, C, laziness, D, professionalism. Answer is professionalism. Good job. Next one. If a customer approaches a pharmacy technician and expresses anger regarding the long wait for a prescription, the pharmacy technician should A, tell the person to wait until the pharmacist is available. B, roll his or her eyes at the customer to show disapproval. C, listen patiently and maintain eye contact while the person is speaking. Or D, immediately ask security for assistance. Remember, two major things, listening and speaking. We got to listen. I mentioned this many times during the audio lecture. Most of the time, the patient just needed to vent. Okay? Remember, we've been talking about compassion, empathy, all of our videos on customer service. Doesn't always, it's not only about customer service topic per se. It's about patient care. It's about empathy. It's about compassion. Okay? Good. The answer is the answer is C, which is listen first, okay? Of the following options, which is the approach that a pharmacy technician should take with customers who are having difficulty understanding because they speak a different language? You did this at the campus, okay? A, speak louder. B, speak very slowly. C, avoid using slang terms. D, refuse to help. A, speak louder. B, speak very slowly. C, avoid using slang terms. D, refuse to help. Yes, the best answer is avoid using slang terms. No wanna, no gonna, no urban dictionary, no ROFL, whatever that is, no LOLs, okay? Because a lot of these people, especially the immigrants, once who immigrated to the US or here, they speak formal English. They learn formal English. So let's try to avoid the slang terms. I know you'll say, speak very slowly. Okay, even if you're speaking slowly, if you're speaking slang or using the urban dictionary, I don't understand some of the things you say sometimes if you use the urban dictionary. I ask you, what does that mean, right? Okay, next one. Like I asked my son, what is OG? Because I've seen it, like OG. It's like, what is OG? You know, the gamers terminology? I don't know those stuff. Okay, I have to ask him. Sometimes he asks me abbreviation and I tell him, hey, that's a bad word. Okay. And he didn't know that's a bad word. Okay. I have to tell him that. You're asked to dispose of patient health information, which is PHI. Patient health information. You're asked to dispose of that in the pharmacy. What is the proper procedure for this? A, cover the PHI before disposal. You can use like a black Sharpie, okay, before you shred it or before you toss it. B, package containers with PHI for incineration. C, shred all documents with PHI. D, all options meet HIPAA criteria. Correct. All options meet HIPAA criteria. What does HIPAA stand for, Robert? It's not a female hippo. What does HIPAA stand for? One of your buddies want to save you, but I want to give you a chance. So tell me if you know or not know.
Like, can I get like a couple seconds to think about it real quick? It's
We'll
on the tip of
blame
my
you
tongue.
we will blame you for going past 12 then.
It's on the tip of my tongue. It just
HIPAA is HIPAA, not double P. What is that? It has something to do with confidentiality, right? So
Yes.
the information of the patient should not show, should be confidential.
Health insurance portability and accountability.
What's the A? Other A.
Other A. I don't know.
Someone was messaging him directly, huh? I can see your faces. I can see who's committing a crime.
But Miss
Right
L,
now.
if someone messaged me, wouldn't you think they would give me the other A too? Come on now.
Now you're at fault. You messaged him the answer, but you didn't message him the complete answer.
It was my brain that messaged me the wrong answer now. Come
Yeah?
on.
You know, guys, you cannot BS me. I've been a student more than 2 decades. I took my pharmacy school on top of elementary, high school, and then I took MBA. So I've been a student a long time. I've been a master at being a student, don't you think? Yeah, so if you are going to send an answer to whoever, make sure the answer is complete or you're going to be blamed. The last word is ACT. Health Insurance Portability and Accountability Act, and it has something to do with patients' confidentiality and privacy. Privacy and confidentiality. Correct. All of this meet HIPAA. Okay, next one. You notice that a pharmacy technician you work with continuously makes mistakes while inputting patient data. You respectfully suggest that she check her work more carefully. She is offended and insists that you don't like her. What should you do? Okay. A, fix her mistakes. B, bring to the attention of the supervisor to help resolve the issue. C, leave the issue alone. Or D, argue with her and let her know that she should look for a job elsewhere. I like the options. Yeah. Of course, we want to say a specific answer that we really would like to do. However, remember, this is a test. So we got to say the right thing. Okay. Rayleigh said none of the above. D in your mind. I like that. But the correct answer really is bring it to the attention of your supervisor. If there's a lead tech, you go to the lead tech first or the pharmacist. Okay. Good listening skills typically include blank as the patient talks. A, appearing preoccupied. B, interrupting the patient frequently. C, maintaining eye contact. Or D, looking around. Okay. Gone are the days when you can't look a person in the eye because you have a crush on that person. That doesn't fly in the medical field, okay? Or here comes the doctor. I get a crush on this doctor. I can't look him in the eye or look her in the eye, yeah? Or here comes the whoever, the other technician, okay? You gotta look the patient in the eye, okay? Because it tells you that you're paying attention and you're listening. Next one. A young woman enters the pharmacy to fill a prescription for Plan B. Okay, we talked about Plan B. The pharmacy technician on duty feels uncomfortable. Okay, dispensing the medication based on religious belief. Okay, this situation would be considered a personal violation. B, pharmacy technician's oath, C, an ethical dilemma, or D, a social code of conduct? What's plan B? Anyone? Heads up in case you're new. Raimi?
Oral contraceptive.
It's an oral contraceptive. This is your morning after pill. You take it within 72 hours. Okay? After intercourse, if the woman is not on a regular birth control. So there's a dilemma there. Okay? We're going to talk about this in law and ethics. Okay? What is that topic? You remember, guys? Robert, Tony, Kevin? Were religious belief
What was that?
can be an issue?
Oh,
Can you repeat the question again?
yeah, please.
What is it? What do you call that?
Can you please?
Conscientious objector? It doesn't only apply to military men who don't want to kill people, who don't want to carry guns. It also applies in the medical field. Conscientious objector. It's against their belief. A pharmacist can have that ethical dilemma. Why? Say, for example, a pharmacist is Catholic, okay? Patient comes, wanted an abortion pill or wanted a morning after pill. I don't want to give that prescription. So what's the solution? Call another pharmacist. It's okay to do that, okay? CVS, in the contract, they sign, pharmacists sign this, okay? So it's not like I cannot fill this prescription, okay? That's a personal choice. That's an ethical dilemma, but there are solutions to it. Call another pharmacist, another technician who can actually dispense the prescription, okay? Send them to another store if there's no other pharmacist in there, okay?
May you spell that, please?
Conscientious, so it's like conscience, conscientious, okay? CONSIENTIOUS, and then objector. Okay. Usually it's more popular in the military because they're going to war. If they're going to war, they don't want to kill people. They don't want to carry guns. But it also applies in the medical field. Okay. We're going to talk about cases like the Hobby Lobby case once you get to your law and ethics class. Okay. Next one. Pharmacists should be alerted for consultations in the following situations except A, a DUR prescription, B, OTC advice, C, every refill, D, every new prescription. A pharmacist should be alerted for consultations in the following situations except A, DUR prescription, B, OTC advice, C, every refill, D, every new prescription. I said this in the audio lecture, right? New prescription is to pharmacist, refill is to pharmacy technician. You always have to call the pharmacist for counseling for new prescription, and then for DURs, which we mentioned. Okay, next one. Good job, guys. Which of the following is an example of acknowledgement that the listener understood the verbal conversation? I said this in the audio lecture. A, paying attention to what is happening behind the patient. B, ask questions to clarify issues. C, repeat portions of the conversation. D, both B and C. The answer is D, both B and C, correct. Okay, here we go. When dealing with angry patient, I talked a lot about this, okay? Customer or coworker, you must learn how to A, return to your work. B, remain calm. C, stop him or her from talking. give him the hand. D, break off communication. When dealing with angry patient, customer, or coworker, you must learn how to A, return to your work. B, remain calm. C, stop him or her from talking. D, break off communication. Always remain calm, no matter what, okay? We cannot control other people's action. Remember that? But we should always control ours. Okay, next one. Every day you come to work and feel uncomfortable with an employee who constantly tells crude and vulgar jokes. This is considered A, discrimination. B, constructive criticism. C, HIPAA violation. Or D, harassment. There are so many terminologies in your customer service packet, Cass. This falls under harassment, correct? If stress in your personal life affects your interactions with pharmacy customers or patients, then it's a good idea to A, take a short break so you can once again focus on your work. B, refuse to interact with customers. C, let customers know you are stressed. D, leave work immediately. I hope we could just do the D right away, right? But no, okay? Take a break, take a short break. Did you see the importance of break? I do it with you too, okay? I do it with you too, even if it's just 5 minutes or 10 minutes, just to breathe, regroup, walk, okay? I wanted to give you more breaks, however, we can't afford it right now. Okay, the emphasis on retail pharmacy today is on A, discount pricing, B, customer care, C, expansion of non-drug merchandising, or D, extensive drug inventory. As a pharmacist, our answer will be different. Real pharmacists working in retail will answer a different answer than the correct answer. Okay. Correct answer is customer care. Okay. Customer care, which is B. Pharmacy customers are more likely to have confidence in a pharmacy technician who A, looks at their cell phone while the customer is speaking. B, devotes their attention to them when they are seeking assistance. C, speaks quickly. Or D, stares at the floor or ceiling while speaking. When do your patients become confident? When you're what? When you're paying attention, correct. Okay, which of the following is an adaptation of communication for patient with hearing loss? Okay, hearing loss. A, learning sign language. B, looking directly at the patient when speaking. C, reduce background noise. D, all of the above. All of the above, okay? This is a thing though, I want you to learn this. When a person or a patient is hearing impaired, okay? The number, hearing impaired, not totally deaf, okay? Like older patients, you don't make your voice louder, okay? No. They're gonna say, why are you yelling at me? I'm perfectly fine, I can hear you, okay? So the strategy really is to speak slowly for hearing impaired, okay? Why? A lot of these people have had that problem for a while and they've learned how to read lips. So the correct way to handle it, not deaf, huh? Is to speak slowly. That clear? Not louder. Oh, but we have masks on. Correct. How do we do that, right? Okay. We're getting off of the masks soon. But yeah, you're right. I used to, prior pandemic, when I'm in the lab, I used to wear a mask and I draw lips on my mouth, like a smiling lips. Okay. So that they can tell that I'm still smiling. Okay. And then in pediatrics in the hospital, we make balloons out of our gloves to make some kids happy. Yeah. Okay. Next one. Todd is a pharmacy technician at a community pharmacy. Which option is the most appropriate way for him to answer the pharmacy telephone? Okay. Without me giving an option. Robert, I think you could nail this one. How do you answer the phone?
Do I just is that just the question? How do I answer the phone, or is there
Yeah,
more
I'm
to
not
it?
going to give you an option. I wanted to answer you to answer the, because I said this in the audio lecture too.
Okay. So if I answer the
Ring.
phone, I'm going to have a clear speaking voice and I'm going to sound very happy. And I'm
Okay.
going to be like, how are you today? How can I help you?
Okay. What else? Tony, you're shaking your head. Can we make it better?
Oh, no, I don't think so. That's pretty good.
What about you, Kevin?
Make sure we sound professional. We introduce ourselves. We ask what they need help with, and we don't want to delay the phone, like not have it ringing. Like usually want to answer before the third ring, like on the second ring.
Yeah, very good. Okay, Raimi, can you reenact picking up the phone? Ring, 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 ring. How are you going to answer it?
Hello, welcome to CVS. Is this an emergency?
It's an emergency. I like that one. Just your turn. We can't hear you.
What are we doing? How we answer the phone?
Yeah.
You greet them and state your name and thank you
Say
for.
it. Do it.
Oh.
Ring,
Hi,
ring, ring, ring.
Okay. Hi, this is Jess. Thank you for calling Walgreens. How can I help you?
Very good. Okay. Hello, this is Jess. Thank you for calling CVS, store number, whatever it is. Thank you for calling CVS. How may I help you today?
Would you
Okay.
like to
You
supersize
have-
that?
Very
Oh.
good. You have to state your name and you have to state your store or your pharmacy name. Okay. Remember, they can hear us when we're happy, when we're smiling. Okay. Next one. The attitude a worker should strive to adopt towards job duties, customers, employer, and coworkers is A, indifference, B, appearance, C, health, D, respect. The attitude a worker should strive to adopt towards job duties, customers, employer, and coworkers. Always, 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 always. It's a bumper sticker. Respect. Yeah. My son said F. Is that a gamer's control F function? Something like that. Mom, F means respect on Discord. Is that right? Hey, the gamer is here. What's going on? Help me out. Kevin, what is it? Control F or F?
Just F, like you pay respects in the chat. Like when you
Okay.
play a game, like you beat them, or you're like, oh, like job well done.
Okay.
Yeah.
Is that for real? My son's
Yeah,
not
or-
pulling my leg.
Yeah, or GG, like good game.
Okay, gotcha. I haven't heard the GG. He said, Mom, F. Like, what? I thought he was cursing at me. Respect. Lawrence, we can't relate. Yeah? This is Discord chat. Okay. You know, my table has a sticker that says old zone. When you're not that old, you can't pass my old zone area. Okay, I'm learning. There we go.
Michelle, I have to head to school for IB. Is it okay if I take off?
Yeah,
Yeah, you can take off now. I'm just
Okay,
trying to
thank
see
you.
if I have some other things, but a lot of this are actually practical. One strategy, which is not in your packet. One strategy to help coworkers handle conflicts with each other or with customers is lead. You remember this if you work in customer service? What does lead stand for? What does lead stand for? It's not in the packet, so I wanted to ask you. Anyone who works in retail got trained on this one? Naila, you have an answer? Okay. Lead stands for listen. Listen first. Explain. Acknowledge. And discuss. Listen, explain, acknowledge, and discuss. Okay? Most of the questions on your finals are practical, just like how I was asking you. Okay? But be very careful too with the terminologies. Professionalism, harassment, discrimination, all of these terminologies may come up verbatim. But your final exam on customer service, yay, it's 40 questions, all multiple choice. Okay? Any questions? Okay. Ms. Trisha will see you live at 10 a.m. on Wednesday. Tuesday's final exam. Live at 10 a.m. on Wednesday. Watch out for announcement. Wednesday is the beginning of 2 new classes. PHA 225 and PHA 135. That's your compounding, pharmacy lab skills, sterile and non-sterile compounding, and math. Okay, we start 2 new classes. Ms. Trisha will start off those classes. Is that clear? It's going to be fun. You're going to be at the campus more because we need 30 hours of what? In-campus labs. Okay, that's when you're going to learn how to make lotions, creams, ointments. You're going to have a project too, wherein you're going to create one product that's not available in the market. Okay, any questions? Enjoy your weekend. Do not forget your homeworks. I cannot be repetitive enough. 4 tests on Tuesday. Okay, good luck, guys. Peace out. Happy Friday.